Well, with a huge uptick in weight loss drugs, what should you be aware of if you're taking them or even before you take them? Phil, the pharmacist from Hausers Healthcare, joins us now with some things to watch for. And first off, let's talk about what these drugs do. There's some very popular names and like more drugs keep being added to this, but like what do they all do?
So you're right, they are very popular. We see a lot of commercials out there, you know, ask your doctor, but the question is, yeah, what do they do? Well, a lot of these drugs are called GLP-1s, and GLP-1s is glucagon-like peptide. And glucagon is something that your pancreas produces, and it's a kind of, we can think of it as kind of a counterbalance to insulin. So insulin is removing sugar from your system, kind of thing like that, your blood. And glucagon is when your sugar drops too low, your body produces glucagon to kind of raise that sugar back up. So by mimicking glucagon, we're actually helping the body produce a little bit of insulin. And then on top of that, we found that these GLP-1s can actually slow the food from exiting your stomach, making you feel a little bit more full. And they also kind of trick your body, trick your brain into thinking that it's not as hungry as it should be. So all of these things have contributed to great weight loss numbers for some of the people that take these. Now, these drugs were originally developed for type 2 diabetics because they really do well at maintaining control.
Right, and now it's like kind of I wouldn't say a get thin quickly plan, because it's something you have to be on. You have to be on these drugs if you go on them for the rest of your life for them to work.
Well, and that's one of the things, and that's one of the reasons we really want you to talk to your pharmacist before you talk to your doctor, because some of these discussions that we have with patients at our counters are, is this medication right for me? Well, did you know that, you know, maybe your drug plan doesn't cover this, because not all drug plans do. Maybe you didn't realize that you had to be on it for life. You thought this was just going to be, I'm going to take it for 6 months or a year.
I'm going to lose that 5 pounds. I'm going to, yeah.
Absolutely, and everybody loves seeing the numbers, right? We love seeing the 15 to 20% weight loss that somebody can achieve. So if you're 200 pounds and we're talking 30 or 40 pounds, well, that's pretty attractive. But it's not just about the medication, and this is where I feel the pharmacist and our pharmacists have a great role to play for our patients, is that the medication helps, but the medication has to be in conjunction with a reduction in diet and better diet planning, and also a lot of exercise that can kind of come in there. So when we see these drugs become popular, there's a lot of questions that are out there, and we want to be the front line for some of those questions before you get to your doctor. Before you wait the 2 or 3 weeks to have that appointment, come into your pharmacist and we can answer your questions very quickly.
Because there are some side effects to these drugs.
There can be some side effects, and with every medication, there are side effects, and certainly that's one of our jobs as stewards of medication pharmacists, is to make sure that we take care of and manage a lot of those side effects. So, you know, if you're prone to thyroid cancer within your family, these are not the kind of medications that you want. Nausea and vomiting are I'd say 99% of our side effects that we see, but those individual side effects are going to come up, and everybody's going to be a little bit different, and that's where having those conversations and having that kind of that customized therapy, that customized healthcare, is something that's a hallmark for us at Hausers.
And if they're not part of your drug plan, and we got about a minute left here, if they're not part of your drug plan, like how much does this cost? Is it something that costs like per month or per injection, or?
Absolutely. So there are different forms. There are injections and there are tablets with this, but generally speaking, you're looking at about $300 a month if you're paying for this in cash. Now, if you look at this down in the United States, we're talking thousands of dollars per month that could be for some of these medications. That being said, we know that on the horizon in 2026, some of these medications are going to be going generic, which should reduce the cost for a lot of people for sure. And knowing that a lot of our generic medications are made in Canada, that's another reason to look for the benefit in 2026.
Okay, great, great. That's the first good description I've heard, complete description I've heard of these drugs. So thanks very much, and lots more to come on this. Phil Hauser, Phil the pharmacist. We'll get your links up on our website at chch.com/morninglive.